I really thank Hemophilia societies of three societies that have collaborated with HSBTC for organizing this event for our DNUs. And we really thank all the eminent speakers. They have all covered the new therapies for evolving management of hemophilia in such a comprehensive and nice way, and especially with going on to the genetic counseling and prenatal diagnosis that is covered by Dr. Tulika presently. And our state is, I am really feeling from this comprehensive review that our state is really needs to be progressing towards the newer therapies. And I thank Dr. Atri sir, who is part of our technical committee for hemophilia, and Dr. Arihant as well, sir, from PGI Chandigarh, and who are contributing a lot towards taking up newer initiative for our state. So I'll just go with the review for our state that we have. We all done faster. That is a misconception that if we lead faster, it's not faster, it is longer. So, and also, as we already discussed, there is an X-linked disease that is caused by mutation, and in which causes the clotting factor proteins are not formed, which are needed for forming the blood clots. So this is the missing part, and that is why they tend to be taking for longer. So it has not been covered at only border after that. So as worldwide incidence, the updated document has been already shared by Dr. Atri with you, but we will still have it worldwide. There are more than 2 lakh people living with some form of hemophilia. It is not only hemophilia, it is some form of hemophilia. And the new data has been telling us that it is still underdiagnosed. And hemophilia affecting about 7,000 males in the US, and around 26,000 cases are already identified in India, with all the groups equally affected. And 30% cases are from genetic mutations, but I will definitely say this is underdiagnosed data. It is not, I don't feel it is an updated data about it. So degree of severity, as we all know, it is mild, moderate, severe, depending on the level of the factors. It's mild. For factor 8, 6 to 50% of the factor is there, and if it is moderate, it is checked in 1 to 5%, and in severe, it is less than 1% is considered as a severe category. And current patient scenario, that is, we'll come to that now. So current patient scenario, we have about 829 patients who are registered with the HSBTC all over the state, and see the state covers 22 districts. And then we say that it is only 829 patients. That means awareness level is really less. We really need to focus on the cascade screening that has been covered in the topics. And in this, I will see, we have the chronological order for the districts. We see Ambala has division of the factors, only patients are from factor 8 or factor 9. There are 28 and 2 factors for factor 9, and 53 in Gurugram, and then it is 43 in Jhajjar. So the maximum of Sirsa district is having 85 patients. So that tells us there is maybe a belt distribution also, which goes towards Punjab side, and there also screening things needs to be focused more upon that. So presently, facilities that the government of Haryana is providing for the hemophilia patients, we are providing the free blood products and the blood components at all the government and the private centers as per the NBTC guidelines. We are providing the free anti-hemophilic factors and fever factors in all the government hospitals, and also procurement of these factors as done with the state health budget as they are in the essential drug list. There. And the free transport facility is being provided to the hemophilia patients for to and fro in the bus roadways. But we are trying to update it further from the private facilities also. And there is a free ambulance pickup and drop facility for the patients. And there is a reimbursement of rupees of 80,000 per patient if it is an emergency life-saving situation and they have to take it not from the state but from outside the state. In this state, in this case, we have taken a step further forward. We are trying to do that. That for at times our patients have been admitted for emergencies at PGI Chandigarh, And we have tried to provide the factors from our own state to Dr. Hanson's requests, which have been often coming us toward us, but we try to arrange for them so that patients do not suffer for this. And we have the goal of trying that we should be doing the timely procurement of the factors, and Sir has already told there is always interruption of the supply, so we'll try to make it a seamless supply. And this CMA has been done, organized with the help of the society, Hemophilia societies, because to make our DNOs more aware. Because if they are aware, they can contribute to the multidisciplinary approach that we are discussing today. Because even if we are aware, our pathologists, transfusionists are aware, but the other people are not aware. So first of all, they need to be sensitized, taught about things, more knowledge updated, and then they can go ahead and take up their own clinics and branches so that we can come upon a proper therapy. Okay? And we are going to introduce the new factors, the recombinant factors, extended life factors, and also the non-factor therapies in this group. We are on the process of that. And just now, state is working only on the emergency therapy, but we are going to go forward for the prophylactic therapy also. And government has been, Haryana has initiated first of its kind for providing financial assistance to the hemophilia and thalassemia patients for ₹3,000 per month, with only family, there is a limit of the family income of the patient. That is for 3 lakhs, and for residents of Haryana, it is the first of kind in the whole of India. And we'll share some glimpses of the fortnight that was celebrated by our DNOs in the state on World Hemophilia Day. They have taken up real efforts this time, sensitizing the staff, sensitizing the colleagues, nursing officers, dental associations, dental colleagues, and even I would appreciate they have taken up to the ASHA worker levels also in some districts. It is really commendable. And even in the colleges also, they have done some poster competitions, and those students have made them. Because if it is taken to the education level, to the schools and colleges, then they are going to be empowered. And if they are empowered, they will definitely go for their testing, genetic counseling, and they need to know about it. So I'll just share it. Ambala district, Faridabad, Hisar. Hisar has done a lecture with the dental associations also, and Rewari, Gurugram, Darsing, and Kurukshetra has done a really well done a job in all the sectors. They have conducted everything. They have not left a single thing that I've talked about. So it's really appreciable. Thank you.